Hey, Dave, time for our weekly segment that we actually look forward to doing here every week, the Astria Health House Call segment.
Love it.
And we have, don't look now, we have a neurosurgeon in the house.
I know. I can feel the collective IQ in the room just went up about 90 points, right?
No thanks to us.
Since the doc walked in.
Yeah, I see.
Dr. Peter Grunert, MD neurosurgeon, spine care.
Yes.
So, have you ever had to work on people of a certain political persuasion and found them to be spineless? Have you ever had that as an issue? I won't say which persuasion, but
That's a good one.
Yeah.
Cannot remember that.
Yeah.
Never happened, though, as far as you know.
This is apolitical.
Right.
This has just happened to do with your spine health.
Well,
I shouldn't
many
be spineless.
people, two of us of the three sitting here have spine issues and back issues. So what is it about America and all of our low or mid bad back things? What do you I mean, that keeps you in business, but what's the do you give out preventatives as well?
Yeah, I mean, it's just degeneration. We have a aging population. People want to be very active when they're older. People still want to go hiking. Pickleball. It's many things, and then you develop bone spurs, disc herniations. It's mostly degeneration, and sometimes it's also trauma. People are very active, and we treat that.
What causes a bone spur to form?
That's degeneration. It's basically, too much movement. It's like arthritis, so that it's inflammation, and then the inflammation causes bone to overgrow, just like in your hip. Eventually you have impinged nerves.
I've got some stuff like osteophytes. Is that what you call them?
Yes.
And it's a calcification.
It's not two bones fighting.
Yeah.
I was going to say, osteophyte sounds like Friday night in Gillette on the radio. And
it's kind of like your body wanting to sort of maybe repair or maybe fuse things together, but it's painful is the bottom line.
It really is arthritis, and eventually it's overgrowth of ligaments and bones that eventually impinge nerves or the spinal cord, and then people become symptomatic. They have radiating leg pain, arm pain, numbness, or even weakness, or
all of the above.
Lose ability to walk.
Yeah. I just feel like somebody needs to go in there with a chisel or a file or something, but I know that's not how we do it. So talk about your specialty.
Yeah, I'm a neurosurgeon, and neurosurgery has certain subspecialties like pediatric neurosurgery, vascular, and also spine. Yeah. And people that are specialized in spine, they do basically just like me, broad spectrum of it, wide range, everything from the skull down, to the tailbone, and we treat degenerative conditions, fractures, tumors, everything related to spine.
Where are we at in your profession in terms of the one day being able to have the central nervous system reconnect? Do you think that's ever going to happen? Are we going to get to the point where we can do that?
So the problem is that the central nervous system cannot regenerate itself. You're born with all your nerve cells in your brain and your spinal cord, and they don't replicate.
Not stem cells going in there and helping out?
So far, we don't have. So what we're trying to do is bridge nerve function with electrical impulses, right? So that's where you have you have electrodes that are used to stimulate certain areas in your spinal cord or in your brain. There's companies working on that. Yeah. But so far, we have nothing to really regenerate it, unfortunately.
What's the most common kind of procedure that you would do if we needed surgery? What would it most likely be?
Well, most of what I see is what we talked about before. It's impingement of nerves of the spinal cord.
So do you trim stuff out?
Go ahead.
Yeah,
I do. So I do a lot of minimum invasive surgery. That's kind of like my passion. So I do everything through kind of small incisions, and try to get people out same day or maybe the next day in the morning. Most of the people same day, and then I just try to address what really causes the problem. And I usually do this under the microscope. So it's a microscopic surgery. It's on a very small area, and then you use small, tiny instruments like small drills and so forth to just get tissue that's not supposed to be there off nerves or stabilize the spine. Everything is done through tiny incisions.
I was wondering. I would be petrified to think that I'm working on people's nerves. Is it a challenge, or what's going through your mind when you're doing this with somebody?
You treat the patient like you would want to be treated.
Yeah.
So you have to always respected. You shouldn't be scared about it.
Imagine that it's mom there.
Yeah,
and you're
correct. So you have to imagine this is you or your mother, right? And so, and that comes with the indication. So should I operate or not? The decision making, but also during surgery, it should never be a routine. I mean, we're having a good atmosphere in the operating room. It's not like everyone's stressed out.
What kind of music do you play, or do you?
A wide range.
Do you?
I sometimes ask patients what they want to listen to. I not too long ago had actually a patient who is a relatively famous rock musician, and we played his music.
Really?
I'm not going to mention his name, but
wow.
Or I have patients, anything.
You don't want to be laying on the table and hear "Let the bodies hit the floor." That's probably not the best thing you want to hear.
Isn't it funny? A patient will come to, and for some reason they can't get a Metallica song out of their head.
No, but I think it depends on the atmosphere, but we play all kinds of music. Sometimes you want it to be very relaxed and you listen to classical music. Sometimes you listen to rock music, all kinds.
My choice would be, as a patient, would be whatever you like to listen to.
Yeah, whatever
I
makes
want
the
you
doc
to be in the best mood
feels
possible.
the best, exactly.
No, I had a patient who was a huge Grateful Dead fan.
Oh.
And then I said, "What's your favorite song?" And then we played it. It was Ripple, and we played it. And I played it to a surgery.
Do you use any robotic stuff?
Yes, so we have. So that's technology takes over neurosurgery also more and more. It's always going to be a tool to help. It's always going to be a human hand, to my opinion, and a human mind. We have a robot that helps you navigate things, and of course it's a great tool, but it's always going to be, your mind and your hand that controls it.
We're speaking with Dr. Peter Grunert, and he is a neurosurgeon, part of the Astria family, and I don't want to be like a wimpy guy and just say, "Oh, my back hurts, I better get in and see a doc." How important is it to get an early clinical look at your back if you think you're starting to develop problems? Is that a good thing to do?
Yeah, it's a good question. So it's very important to see someone once you develop what we call neurological deficits, and that's like when you develop weakness. And I'm surprised sometimes how many people walk around with a foot drop. It's when you can't lift your foot.
Yeah.
And that's something that should be addressed very quickly. I always tell people, if you have acute weakness that you can feel, I would go to the emergency room or seek someone that can refer you to a neurosurgeon.
And we're going to need a referral to get in to see you, right? I mean, that's part of the process, yes?
Yes, in most cases, yes. Or you go over the emergency room and then they call me.
Yeah. What about physical therapy or muscle development? Is there much that can be done there? Or after a certain point, it's going to take you and your tiny little instruments and your microscope to help save the day?
Yeah, so surgery, best is always if the body heals itself, is what I tell people.
Yeah.
It should be avoided, even though we do it very safely. So for example, back pain, right? That's the most common complaint people have. It's not necessarily nerve impingement, but just back pain, low back pain. And that should, in most cases, that should be addressed. With conservative care, which includes injections or physical therapy, chiropractic therapy. And I think always you have to identify the problem and then figure out what's best to treat it.
So there would be a continuum of like, all right, here's the guy that's going to first peak this, and there you are waiting in the wings. Like, when it's my turn, we're going in. Is that kind of how? No. Okay.
I don't like. So actually, you have to try to avoid that because it's really about you have to really be 100% sure that you know what's causing the back pain and that that actually what you're offering is something that can fix that. And that's not so it's really about identifying the issue, and then once you really identify it, you know exactly what's causing it, because back pain is really a symptom. It's not a disease. It's like fever. So you can't just say, "Oh, I do surgery for back pain." You have to know that it's 100% helping the patient. So I always say you have to wake up better.
Yeah. So there's you really rely on then scanning procedures, X-rays, and all those different things, diagnostics to be able to.
And injections, I do commonly injections, or I refer patients for injections. And it's very simple. If you have an injection and it helps you with the pain, you know that's where the problem is. Yeah. Right. So it's very helpful, but it's a very stepwise approach, and you have to really be careful not to over-operate or just look for reasons to operate. So most back pain should be handled conservatively.
That's what you want to hear a doctor tell you.
Yeah.
Right. So
well, you don't want to have bad outcomes, so you have to be selective about who you're operating on.
Well, okay, so I think the takeaway is if don't wait if you've got some issues, and for crying out loud, if you're like of the greatest generation or just a little bit younger than that, and you're walking around dragging your foot, by all means, get a referral, get in, find out what it is that's causing that sort of thing, and know that you're in the hands of a doctor who sees, despite this being his specialty, this is the last resort, that you want to check all these other things first.
Wouldn't it make sense to get, if you're unsure, get an assessment at the very least, right?
Yeah, and I think you should. I think it's helpful to also early on see a neurosurgeon, because people just need to, because the surgery is often such a straightforward thing because it can fix something. Of course you want to know, do I have something that you can easily fix with surgery or not?
Yeah.
You know what I mean? And so I think sometimes people just have to hear from a surgeon that they don't need surgery.
Yeah. True.
You know what I mean?
To empower them to do the other kinds of things necessary to get more movement or whatever.
Once you have the right diagnosis and you make this decision with the patient, they all do well with surgery.
Wow.
Like pretty much, you should never. I always tell patients that I would only operate if I know you'll wake up better. And if this is your goal, and you make the decision with the patient, and you're not selling a procedure, they all do well.
Yeah, that's great stuff.
Well, Dr. Grunert focuses on both non-surgical and surgical treatment, as we're hearing now. And again, they don't do the operation unless it's definitely demonstrated to them that that's what will give you the relief that you're looking for. So get yourself a referral and get a hold of Dr. Grunert and enjoy his fabulous accent, which again is from where?
Austria.
From
Vienna, Austria.
Vienna. I think I told you this. My grandfather, his big joke to us when we were little kids, he said, "I'm going to show you Vienna." And then he would grab us by the head and the ears and he'd pick us up like we were somehow getting a view of Vienna by being hoisted up by our ears. Thanks, Grandpa. Grandpa Joe, I'll show you Vienna, because he was from Austria.
Maybe he should be investigated. I
think so. He's no longer with us.
Well,
he's in Vienna of his own, so we'll let him lie. But Dr. Grunert, thanks again. We've had you in here before, and we really enjoy this because so many people have back issues.
Yes.
Anytime we could talk about it with someone who specializes in that, fantastic, and we appreciate your time.
Thanks for having me. Appreciate it. Thank you so much.
Thank you so much. And don't forget, Astria.health. That's where you can go for all the resources you need.